More on pregnancy and births in the time of coronavirus. I'm joined by Spivka from New York. She's the co-author of Why Did No One Tell Me This? The Doulas Honest Guide for Expectant Parents. Welcome to the show.
Thanks for having me.
Now, clearly, it's already a stressful time for people, let alone with the added layer of pressure as an expecting mother. Tell us a little bit about the impact for expecting mothers right now with this pandemic.
Yeah, totally. So, pregnancy in and of itself is an uncertain time, right? We don't know when labor is going to start. We don't know what it is going to feel like. It is the world of unknown. And so being in a time where the whole world is in a place of unknown just, obviously makes people feel more anxious.
And so what about the health risks for pregnant women and for newborns? Are there any added concerns that they have?
Yeah, so, right now we don't know. And in terms of COVID itself, we do know that obviously pregnant people's immune systems are a little bit different than when they are not pregnant, but we don't really have that data yet. And I think that's part of where the anxiety comes from. Now, the other end of that we have to think about is for those who are giving birth in hospitals and in some cities like New York, where we're very busy, what that means for busy staff, for hospitals where there's understaffed, and where resources are going other places. And so, one's safety within the hospital system may all of a sudden start to feel different.
And certainly with the US already having the highest maternal death rate among developed countries, with hundreds of women dying annually in childbirth, are there then concerns that this pandemic could exacerbate that?
Totally. And, especially in New York City, and this is nationally, we see, particularly for women of color, their risk is 4 times higher. In New York City, it's 8 times higher. And we're seeing those patterns outside of pregnancy with COVID in and of itself. So it certainly is a concern, right? The healthcare system is taxed right now, and they're doing all that they can. So this isn't a knock on them. It's just to say that pregnant people are vulnerable. They need to be cared after. And when people are busy, when people are scared, when we're only looking at numbers outside of a screen and unable to step into the room, into the labor and delivery room, and actually see what's going on. And we don't have a lot of postpartum care in America to begin with. Post-birth during COVID with even fewer resources, yeah, it does feel like the risks are higher, and only time will tell.
And it's certainly hard with all this uncertainty. A lot of pregnant women, you go into it with this birth plan. I want it to be in a hospital or at home. How is COVID-19 changing birth plans, and what are some of the challenges that come with those changes?
Totally. Well, I always like to tell people that we call them preferences instead of a plan, because you really can't plan for anything. And this really goes to, exaggerate that idea. But for sure, I think we see this trend in people wanting to switch to home birth. Home birth midwives are slammed right now, which that has never been the case really in America before. So that's been a really interesting trend.
And you touched on this earlier about the support system that's not just needed during labor, but also after birth. You have a lot of people who may be perhaps suffering from postpartum, or wanting to give birth with a partner there, but they're being advised to be alone to reduce the risk of infection. What sort of advice do you have for them?
Yeah, absolutely. So this is different hospital to hospital, state to state. The policies are very different. I always say, get the most up-to-date information possible in the place that you are giving birth so that you can be emotionally and mentally prepared. Bring a tripod with you if you are someone who's giving birth alone. That way you can have your hands and be with your baby and still be in touch via Zoom or video chat with your loved ones at the same time. And ask for help from the staff that is there. They are there to help you. And if at any point you feel like something isn't right, something feels off, go with that gut instinct and just ask for help.
Now, I do want to talk about information overload. Even before you give birth, you get all this information about what you're supposed to be doing, what you should be thinking about that. Now, when you add all the overload of information we're getting about the virus, what are some resources that women can turn to really try and cope, not just with going through the pregnancy, but also to protect their children as well?
Absolutely. I mean, the CDC has up-to-date information that is always worth checking to see what their recommendations are at a given time. Use your support team. Remember, when we look at recommendations from organizations like the CDC, they're looking at the general population, and your practitioner that you're working with directly is there to help you take that bigger information and figure out how you as an individual fit into that puzzle. We all have really unique circumstances, different traumas, different genetics, different backgrounds, bodies, health concerns, etc. And so we need to make sure that what is being recommended by the CDC, what's being recommended by certain policies are also correct for us as individuals and vice versa.